If you have symptoms that suggest lung cancer, your doctor will perform an examination. If your findings are still concerning, more tests, including blood work and X-rays or scans, will then be ordered. If the chest X-ray or CT scan shows an abnormal growth that could be a tumor, additional testing is performed to make a diagnosis. Usually, a piece of the growth will need to be removed and examined under a microscope. This procedure is called a biopsy. Importantly, the decision to perform a biopsy doesn't mean that cancer is present. Biopsies are routinely performed to check for both cancer as well as other diseases which are not cancer. A biopsy can be done in one of several ways. Bronchoscopy is a procedure where a flexible tube with a camera is inserted through your mouth or nose and then into the windpipe called the trachea. This procedure requires light sedation or anesthesia. CT-guided fine needle biopsy is performed by locating the tumor with a CT scan and inserting a thin needle through the skin into the lung to remove a tiny sample of tissue. Needle aspiration is performed by inserting a needle into lumps or lymph nodes that can be felt under the skin or into fluid collections in the chest. Thoracentesis is insertion of a needle and catheter into fluid collections in the chest to remove the fluid and look at it under a microscope. Surgery may be needed to remove the tumor if the tumor is small and it is not possible to get a sample of tissue any other way. In addition to looking at the tumor under a microscope, some lung cancers may also be tested for specific biomarkers. These biomarkers are abnormal proteins and gene mutations that can be found in cancer. If present, these biomarkers may be used to decide between treatment options. Common biomarkers in lung cancer include EGFR mutations and ALK translocations. This is a rapidly changing area of lung cancer research, and the list of biomarkers is expected to grow quickly.